Welcome to the first session of El Camino Hospital's Preconception and Pregnancy webinar series, Planning to Get Pregnant. Are you thinking about getting pregnant in the next year? Well, this is what you and your partner need to know. For anyone who has dialed in by phone, please select telephone and enter your audio PIN number in the audio panel to eliminate any echo. This will also give you muting control. And you will all be attending in listen-only mode. Hi, I'm Nurse Barb. I'm a women's health nurse practitioner here in the heart of Silicon Valley. I care for women who deliver their babies at El Camino Hospital, and I've been asked to share with you what I tell my patients when we talk about what they need to know when planning for a pregnancy. Before we get started, here are a few details about tonight's webinar. If you haven't already downloaded the personal assessment, you can do so by clicking on the link in the handouts section of the control panel. We also recommend that you download the Grow Personalized Health Management mobile app, and you can find the link for that in the chat box. Be sure to take notes throughout today's session. You can do so on the personal assessment or on your own pad of paper, your computer, or whatever's most convenient for you. We'll have time at the end for questions. But please, if you have any that come up, please type them into the chat box. We will get to as many as we can at the end of this webinar. At the end of the webinar, you'll also be sent an email with a link to the resource guide as well as other valuable tools. Today's presentation was developed by a team of experts here at El Camino Hospital in the heart of Silicon Valley, including myself. So let's get started with this webinar, Planning to Get Pregnant. Now, to get us started, I'd like to ask you, what's influencing your decision about becoming pregnant? So we're going to launch a poll, and I want you to take a few moments and select the answer that best suits you. So are you getting pressure from family or feeling pressure from your partner or even your friends to get pregnant, or maybe it's none of the above and you're feeling your own pressure inside? So I'm going to give you a few moments to select your answer about whether or not you're feeling any pressure. Because, you know, the idea of starting a family can seem very exciting and yet very overwhelming at the same time. And as you consider whether you want to become pregnant in the next 6 months to a year, there's a lot of things that will influence your decision. And there's a few important things that you and your partner will need to know in order to prepare. So what I can see here is that about 36% of you are feeling a lot of pressure from family, and about equally 18% are experiencing pressure from partners and friends, but some of you are not feeling any pressure at all. You're just here to gather information, and that's great. So what are we going to talk about tonight? We'll cover how you envision your future as a mom, a dad, and as parents. We'll talk about how do you communicate with your partner and both partners' medical history and medications, including prescription, over-the-counter, herbs, and complementary treatments. We'll talk about your family histories. We'll also talk a lot about women's age and whether or not that should be considered when it comes to risks for birth defects and other complications. It's very important to talk about getting enough sleep. And you know, I also live and work here in Silicon Valley, and I know that reducing stress and paying attention to your mental health is especially important. We'll cover what you need to know about recreational drugs, alcohol, and smoking. And because so many of us travel, we'll tackle considerations when traveling, including vaccinations. And then we'll cover some of the ways that El Camino Hospital can enhance your experience during pregnancy, delivery, and beyond as you become parents. Because our goal here is to help optimize your journey to becoming parents. Are you starting to notice more pregnant women, new moms pushing strollers, and dads with little ones in carriers? If so, you just might be starting to think about becoming parents yourself. Everybody approaches this process from their own unique perspective. What are you thinking when you consider your personal timeline for getting pregnant? Maybe you want to be pregnant in 6 months. Maybe it's a year or more away in the future. Perhaps you're hoping it will be within the month. No matter what, there's a lot to consider as you prepare and as you envision your future as a mom. Many women find it helpful to write down the factors that are influencing their decision about becoming pregnant. How does work, school, and your career fit into your plans? What about your partner? Are their ideas about timing in sync with yours? You know what? It's normal for one person to be ready for a baby and for their partner to be more hesitant or have other priorities. Maybe you're feeling the pressure from family to have a grandchild. That kind of pressure can be very intense. Perhaps you've got some plans for the future and the idea of a baby just has to wait until later. Or maybe you're already a mom or your partner has children and there's pressure on you to have a sibling. It's completely normal and natural to map out what you think your life will be like and then find that life, school, partners, family, work, and everything in our busy and complicated lives aren't exactly lining up the way we thought they would. It's natural to feel overwhelmed by the normal everyday pressures of life, especially here in Silicon Valley. And it's also normal to be hesitant to add a new baby to your already busy life. Perhaps you're feeling pressured to delay pregnancy until you've accomplished your goals. No matter what the factors are that influence your decision, it's helpful to write them down and then take some time to think about what's most important to you. Let's talk about becoming a dad. The reality is that so much of the focus on pregnancy planning is on women, and yet men are also on their own journey to becoming fathers. Many men find it helpful to spend some time thinking about and maybe even writing down some thoughts about how they envision their lives as a father. What is important to you? What do you see other men doing? What do you want to avoid doing? What did you appreciate or not appreciate about your father, grandfathers, uncles, and other important men in your life? What kind of dad do you want to be? What would you like to accomplish in your life before you take on the added responsibility of a baby? Is your work, school, career, and lifestyle in line with how you'd like it to be as you think about becoming a father? And where does a baby fit into all of this? Don't worry if this seems a little overwhelming right now and is kind of far in the future. It's good to start thinking about these issues and talk about them with your partner. Speaking of talking to your partner, let's talk about communication. Having a baby is wonderful, magical, and life-changing, and also an incredible responsibility because you'll be providing love and 24/7 care for a tiny, helpless baby who will grow and change into a unique child. There are countless things that will change in your life, your partner's life, and your path forward. Some of these things can be anticipated, and some just cannot. As you and your partner consider becoming parents together, the very best gift that you can give your much anticipated and wanted child is a good relationship with one another. Children benefit when there's lots of love and also when their parents are respectful and supportive of one another and parent as a team. And all of that starts with mutual respect and good communication. Maybe you're already great communicators. Maybe you've been so busy it's been hard to find time to connect. Either way, or anything in between, it doesn't matter. Start wherever you are now. Find time to talk about your hopes and dreams for your future together as a couple and as parents. And also, talk about your concerns, worries, and what you envision together. So here's a few tips that might help. First, agree to just listen to each other's ideas and thoughts about what's most important without any judgment or trying to defend your own viewpoint. Wait to respond. Remember, you're each in the process of gathering information and learning more for better understanding. Then try to reflect back on what you heard from your partner so you can make sure that you understood them correctly. Of course, clarify anything that was confusing, and then list each other's priorities and concerns, again, without any judgment or the very, very natural impulse to try to get your own way. You might be surprised at what's important to your partner and what you agree and disagree about. Before you try to convince one another to change priorities or timelines, do start with what you both can agree upon and then build from there. It's so important for both of you to feel heard and respected and not to push one person toward pregnancy and parenthood before they're ready. It's also important to talk about work-life balance, how your families play a role in your lives, finances, and your living situation, as well as all the other influences in your life. I'd like you to ask yourself, when would you like to become pregnant? So really think about this. It's really important to have an idea about what works for you. Is it 3 months from now, 6 months, a year, or just sometime in the future? As you dive deeper and you think about your hopes and dreams as parents, here's some questions to consider. So what would you like your life to look like? And how will you juggle work, school, and family factors into your life and your lifestyle with a new baby? How's your health? How's your living situation? Do you think about moving to someplace larger or smaller? How are your finances and how do they figure into your decision? What about work or school? Are you going to school part-time, full-time? Do you work? Do both of you travel? Does one of you travel? What does your future look like? And where does a baby fit into all of this? Remember, there's no one right or wrong way to do things here or one way that's best. You are a unique couple and you'll be creating a unique family. You'll want to discover your own unique path that you can both feel good about. And using this kind of healthy, respectful communication will really help all aspects of your relationship as you continue your lives together, hopefully becoming parents, and as you face other challenges. You know what? We always focus on women first when considering pregnancy, so let's change that up and start with the guys. For the men in our audience tonight, how about your health? Do you have any health conditions that you might have been ignoring? If you have, you're not alone. Don't feel guilty. But also, don't put off seeing a healthcare provider yourself. You may be surprised to learn that women see their healthcare providers every year. That's right, every year women go in for an annual exam. And so as you consider becoming a dad, now's the time for you to make sure you've had your blood pressure and cholesterol levels checked and that you're up to date with vaccinations. Remember, pregnancy and parenthood is not just about women, it's about you as a couple. As a man, your health, lifestyle, and routines contribute to whether pregnancy is even possible, so make that appointment. On the El Camino Hospital website, you can access the Find a Doctor portal. You can search based on lots of different criteria, including specialties and languages spoken. This is also the time to ask your family about any inherited conditions or if there have been any children born in your extended family with any serious medical issues or birth defects. While we're on the subject of family history, this is a good time to talk about both partners finding out if there are any inherited conditions in the families that could affect the woman's health, her partner's health, or any of your future children? Are there any conditions that have affected children or adults in either family? Was there cystic fibrosis, sickle cell anemia, Tay-Sachs, or any other condition? Have there been any serious issues that have caused an early death? Were there any babies born with serious birth defects or anyone who needed surgery soon after birth? Finding out about your family history can be a little daunting, and many people feel uncomfortable asking for this information. That's why El Camino Hospital is providing a downloadable resource guide at the end of this webinar that includes information about how to obtain your family history with a link to My Family Health Portrait. In addition, if there are concerns about the family history and inherited conditions, you may want to talk to your healthcare provider or a genetic counselor before trying to get pregnant. Genetic counselors interpret your family and medical history to determine the chance of a genetic condition occurring in your children and help you better understand inheritance, testing, management, and prevention. There are also many resources available through your healthcare provider. Now we're going to talk about one concern that many people have, and that is whether they are at risk for having a baby with a serious genetic or chromosomal defect. Many women wonder whether they should rush to have a baby before a certain age because of the added risk to a pregnancy from chromosomal abnormalities. The term chromosomal abnormality can be both scary and confusing, so let me take a moment and explain what this means. When the egg and sperm get together, each parent contributes 1/2 of the baby's genetic DNA. Each parent contributes 1 copy of each of their 23 chromosomes, and when they combine, the result is 23 pairs of chromosomes. In this slide, you see 22 pairs plus the XY at the bottom right of the slide. XY means that this is a boy. If it was XX, it would be a girl. In rare cases, one parent will contribute both copies of a chromosome so that instead of a pair, what you end up with are 3 copies, which is known as trisomy. When there are 3 copies of a chromosome, or a trisomy, it causes varying degrees of physical and mental problems. As you can see from the slide, that at site 21, there are 3 instead of 2 chromosomes, and this is trisomy 21, which is also known as Down syndrome, and is the most common chromosomal condition according to the March of Dimes, and affects less than 1% of pregnancies. Other chromosomal conditions, such as trisomy 13 and 18, are even more rare. You may have heard that as women get older, their chance of having a baby with a serious chromosomal condition is increased, and that's true. It's understandable to be concerned because while the risks of these conditions do increase with age, I would like to help put those risks into context because the overall likelihood of having a pregnancy affected by a serious chromosomal condition such as Down syndrome is still quite low regardless of age. As you look at this chart, you can see a woman's age on the left side, and on the top you can see the risks of having a pregnancy with Down syndrome, and following to the right, the risk of all abnormalities, which are also known as anomalies. As you can see, when a woman is 25, the chance of her having a pregnancy with Down syndrome is approximately 1 in 1,250. And if you follow the chart across the top to all anomalies, the risk of all anomalies at age 25 is 1 in 476. Now, as you look down at the risks at age 35, you'll see that the likelihood of having a pregnancy with Down syndrome is 1 in 378. Now, at first, that might seem like a big increase in risk from age 25, and it is a slight increased risk, but the overall risk is still well below 1%. Another way to think about it is that at age 25, if there's a group of 378 women who are all pregnant, 377 of them will not have a pregnancy with Down syndrome, and 1 will. At age 40, the risk of Down syndrome is 1 in 85, which is still less than a 2% risk. You may be wondering about whether a man's age is a factor. What I can tell you is that more studies are needed here because fathers over age 40 may have a very, very slight influence on the risk of miscarriage and other conditions. And again, if you have concerns, do talk to a genetic counselor. You may be wondering, how do we test for chromosomal conditions once a woman is pregnant? In the past, we only had invasive tests such as amniocentesis and chorionic villi sampling to screen for chromosomal anomalies. Both of these had very slight risk of miscarriage. But now things have changed, and we now use simple blood tests which have no risk of miscarriage when we're screening a pregnant mom as early as 10 weeks for serious chromosomal conditions. These tests are known as NIPT, or non-invasive prenatal testing. The term non-invasive means that there is no risk of miscarriage because only the pregnant mom's blood is tested. These are very sensitive blood tests that detect the baby's cell-free DNA to screen for chromosomal conditions. How cool is that? I mean, virtually all of my pregnant patients have NIPT because it can be done early in the first trimester. I know that this is a lot of complicated information, and this might bring up even more questions. Remember, there's a resource guide that's available after the webinar is over. And as always, if you have more questions, do seek out an OB provider or genetic counselor. So let's move on and talk about a woman's own unique personal history. It's recommended that you have a preconception visit with an obstetric provider before getting pregnant. And it's helpful if you can write down this information to share with them. They want to know the following things. When did you first start having your periods? Were they regular? How often do you get your periods, and how long do they last? Have you ever skipped more than 3 periods? Were you ever diagnosed with polycystic ovarian syndrome, which is also known as PCOS? Were you ever diagnosed with a sexually transmitted infection such as chlamydia, herpes, or others? And if so, which ones? How long ago, and were they treated? Have you ever had an abnormal pap smear? And if so, when was that, and how was it managed? Were you on, or are you on now, hormonal birth control such as the pill, the patch, the ring, implants, IUD, or injections? Are you having any side effects, or did you ever have side effects? Also, have you been trying to get pregnant for more than a year or ever diagnosed with infertility? And has your partner ever fathered a child? Let's talk about any previous pregnancies. Have you ever been pregnant in the past? Did you have any complications with your pregnancy or pregnancies? Have you ever had a miscarriage or termination? Did you give birth vaginally or by C-section? Were there any complications with your pregnancy or with your delivery? When and where did you deliver? And are your children healthy? We also want to know about both partners' unique medical histories. Have either of you ever been diagnosed with or been told that you're at risk for diabetes, high blood pressure, asthma, a thyroid disorder, a seizure disorder, hepatitis, or any other condition? If you have been diagnosed with a medical condition, how long has it been since you've seen the healthcare providers who manage your conditions? If it's been more than a year, then now is the time to follow up and make certain that you're both in the best health you can be, because these conditions can interfere with your chances of becoming pregnant. In addition, for women who become pregnant, their medical conditions such as diabetes, high blood pressure, and thyroid disorders can worsen and increase the risks to both mom and baby. So now is the time to optimize your health. Let's talk about surgical history. Have either of you ever had any surgeries? If so, it's helpful to list the types of procedures you've had, why they were done, and when. And how was your recovery, and did it help your condition? For the women listening, did you have any complications with anesthesia? It's also important to find out whether the conditions you had surgery for helped your issue resolve completely or just partially. Have either of you ever had to spend one or more nights in the hospital for an illness, injury, for depression, or to recover from a surgery? And while we're talking about hospitalizations, have either of you been to the emergency room in the last year for any reason? And if so, what happened? And how are you feeling now? If it seems like we want to know everything about you and your health, it's true, we do, because it helps your healthcare providers take the best care of you. I'd like to talk now about any prescription medications that you may or may not be taking. If you have had any medical conditions and you've been advised to take prescription medications, it's very helpful to list all of them, those that you take every day and those that you take as needed. If you have prescription medications, you can take a photo of the containers and the instructions, or you can write down the names prior to any visit with a healthcare provider. Here at El Camino Hospital, we know that most people also take over-the-counter medications, herbs, homeopathic, Ayurvedic, or other traditional medicines and treatments. I know I do, and so do many of the providers you're likely to see here. So please, do list all of your medications, herbs, and complementary medications or treatments with your providers. We won't judge you or ask you to stop unless these interfere with getting pregnant or having a healthy pregnancy. For example, valerian root, black and blue cohosh can interfere with getting pregnant, while peppermint and fenugreek are considered safe. When thinking about getting pregnant, it's essential for your providers to know what may be affecting your body, menstrual cycle, your energy levels, and what might be interacting with other medications. And following up on the previous slide, here's a question. Have you been diagnosed with a health issue such as a thyroid condition or high blood pressure? Or perhaps you've been told that you're anemic and it's been recommended that you take a prescription medication, or you've been advised to take a vitamin or iron supplement, but truthfully, you might not be perfect taking what's recommended. Look, I just want to reassure you, this is a guilt-free zone. Sometimes I have a hard time remembering to take my medications and vitamin supplements. It's normal and natural to forget. A lot of people forget to take their medications from time to time. Sometimes people even stop their medications without discussing it with their healthcare provider. So if you've been forgetting your medications or only taking them occasionally, or have stopped taking them without consulting your provider, then now's the perfect time to go see them so that together you can figure out what's best so that you can do everything you can to be as healthy as possible before trying to get pregnant. So here's what I do to help me remember to take my medications, and this might be helpful to you. I put my morning vitamin supplements next to an empty glass next to the coffee maker, and this reminds me to fill up the glass with water while the coffee's brewing and I take my vitamins. For nighttime medications, I leave the pill bottle next to my toothbrush to remind me to take them when I brush my teeth before bed. So let's talk a little bit about sleep. So on average, how much sleep do you get a night? So we're going to take a little poll here. How many of you are operating on 2 to 4 hours of sleep? How about 4 to 6 hours, 6 to 8, and for those lucky few, maybe getting 8 or more hours every night? Because let's face it, working and living here in Silicon Valley can be a high-stress environment, and lots of people are not getting enough sleep. It's common for both men and women here to have long commutes and even longer work hours that continue once they get home. People are working well into the night, so it looks like 90% of people are getting 6 to 8 hours and only about 10% 8+ hours. And I'm really happy to see that no one is operating on less than 6 hours of sleep here. So that's really great. Since you're getting the recommended 6 to 8 hours of sleep each night, That helps you function at your best. So if you're having nights where you're powering through on 4 to 6 hours, when you think about becoming pregnant, this is the time to start healthy habits so that they become a routine. When it comes to couples, maybe one person is sleeping well, but the other is having difficulty, which may prevent both of you from getting the rest you need. Be sure to talk to your healthcare provider if you're using any over-the-counter or prescription medications to help you sleep on a regular basis, as some of these medications are highly addictive and are not recommended in pregnancy, while others are considered safe to use if needed. So how do you get more rest and sleep? Well, your bedroom should be a restful place where you go to sleep and have sex, which, by the way, is how people get pregnant, right? And we're going to talk more about sex in our second webinar. It's also important to avoid having any screen time at least 1 hour before bed. Try to avoid caffeine after 4 p.m. and develop sleep routines that you stick to, such as going to bed at the same time each night. If you're having any trouble falling asleep or staying asleep, then do consider using mindfulness or meditation, and do talk to your healthcare provider. It's also possible that you're already feeling very overwhelmed by the demands of work, school, travel, family, your relationship, and friends. Many people everywhere, and especially those that live and work in high-stress environments like Silicon Valley, may be feeling depressed, anxious, irritable, frustrated, or a combination of those emotions just from their daily routines. Here in Silicon Valley, every single day, I hear my patients, friends, and colleagues say that there's just not enough time in the day to get everything done. So if you're feeling this, you're not alone. The key is to prioritize what's important and try as best you can to find some balance in your life. Now, before you feel overwhelmed by me adding this suggestion that you try to become more balanced as yet another thing on your to-do list, don't worry. Many experts advise striving for work-life balance within a week, not trying to cram work-life balance into each day. That means that some days might be devoted mostly to work, and on other days you can find more time to relax and enjoy the life you're working so hard for here. So while you might not be able to find balance every day, you'll feel better if you can find balance between work, fun, exercise, and rest within a week's time. Let's talk a little bit about depression. If you've ever been depressed or had anxiety in the past, the stressors you might be facing now may make those feelings even more intense. Many people find ways to reduce their depression and/or their anxiety by using mindfulness, or through exercise, or from being in nature, or any number of activities, from relaxing with friends and going to the movies to playing video games or enjoying other activities. Others may look to alcohol, smoking, energy drinks, or recreational drugs to manage their stress and their feelings. If you're currently taking prescription medication for depression or anxiety, it's important to consider if you're feeling a little better or a lot better. When it comes to moods, our goal is not for people to just get by. Our goal is to help people enjoy their lives. This might mean talking to a therapist, adding mindfulness stress reduction, or adjusting your medications. For women, it's also crucially important to talk about any medications you might be taking for depression or anxiety with your healthcare provider before you get pregnant to determine if they're recommended in early pregnancy. Now, we talked a little bit about depression earlier, and I want to say that many people cope with their daily demands by smoking, using alcohol, marijuana, or other recreational drugs. It's very understandable to look for ways to cope with the pressure and demands of our daily life, and yet these things are detrimental to your overall health for both men and women, and they can all possibly interfere with your ability to become pregnant. If you're concerned about your own or your partner's use of any of these substances, then do utilize the resources we have here to help that person stop. And do talk to your healthcare provider about how to access other tools to manage your stress. Now we're going to take off on a new topic. Let's talk about travel. Whether you're planning a honeymoon, a big trip to see family, or a few fun trips before becoming parents, there's a few things to consider. Number one, how safe is the water and food? And have you been vaccinated for hepatitis A, a common and very serious and preventable infection that comes from contaminated food and water? Many people have not had the 2 hepatitis A vaccines that are necessary to protect them. You might also want to reconsider street vendors and food that hasn't been refrigerated or fully cooked. Pregnant women are at much higher risk for contracting serious food poisoning. Are you up to date on all of your vaccinations? Will you be traveling to places in South America or Africa that require a yellow fever vaccine? According to the Centers for Disease Control, or CDC, yellow fever vaccination has not been known to cause any birth defects when given to pregnant women. However, yellow fever vaccine is a live virus vaccine, so it does pose a theoretical risk, and it's recommended that women wait at least 1 month after receiving the yellow fever vaccine to become pregnant. And I know you're concerned about the Zika virus, and I am as well. According to the CDC, the Centers for Disease Control, for men who travel to areas where there is a risk of Zika virus, the couple should avoid pregnancy for at least 6 months, even if he has no symptoms. For women who travel to areas where there is a risk of Zika, the couple should avoid pregnancy for 2 months, again, even if she has no symptoms. And if both partners travel to areas with Zika, they should avoid pregnancy for 6 months. Of course, if you're traveling to an area where there's Zika, it's also very likely that there's malaria, dengue fever, or chikungunya, which are all mosquito-related illnesses. So, if you're traveling to those areas, take precautions against getting bitten by mosquitoes. That means stay in areas where there are screens, use mosquito netting and air conditioning, and if you're outside, wear long sleeves, use mosquito repellent if you're going out at dawn or dusk, which is when these mosquitoes tend to be most active. We've talked about a lot of important things to consider before becoming pregnant. If you're considering pregnancy, conception, physical exam. If you're considering pregnancy, now's the time to see your healthcare provider for a preconception physical exam, which may include a pap smear, screening for infections, and time to discuss all of the issues we talked about today, including your medical history, your family history, medications, vaccinations, and other concerns. Now is a good time to start taking a prenatal vitamin with DHA in it. DHA is an omega-3 fatty acid that's found in fish oil. And this has been shown in research to help with a baby's brain and eye development. You can take the over-the-counter brands, which are also available in formulations for vegans and vegetarians. It's important for you to take a prenatal vitamin that has folic acid in it. When women take folic acid for at least 3 months prior to pregnancy, they have a reduced risk of delivering a baby with a serious neural tube or spinal cord defect. When you're thinking about becoming pregnant, you don't need to stop using your birth control method until you're actually ready to become pregnant. Because once you stop taking the birth control pills or stop using the ring or have an IUD or implant removed, you can become pregnant within days. There's no need to wait to try to become pregnant for 2 or 3 months. Many people think that they have to let the hormones get out of their system, but these hormones will be out of your system and cleared from your body within a few days. When it comes to men, now's a great time to show your partner that you're also committed to your health by having a physical exam. It's important that you too talk to your healthcare provider about all of the issues we talked about today, including your medical history, your family history, medications, vaccinations, and other concerns. When it comes to vitamins, be sure you're eating a balanced diet with at least 3 to 5 servings of fruits and vegetables each day. And if you're not, then consider a multivitamin. Men who are trying to become fathers can benefit from a vitamin with added zinc, as this is an important nutrient for healthy semen. So what does El Camino Hospital offer? Well, they offer a lot of things. This is where I delivered my baby, and I hope that you'll consider El Camino Hospital for your family too. After this webinar, a resource guide will be sent to you that includes choosing an OB provider, options such as midwifery and doulas and other community resources. And you can use the search tool on El Camino Hospital's website to find a doctor, where you can find culturally appropriate referrals to providers who speak your language. There's also access to our Health Library Resource Center. In addition, El Camino Hospital offers many culturally appropriate programs and services related to specific health concerns, such as diabetes and heart disease in people from India and South Asia, and hepatitis in people from China and other parts of Asia. These are both part of the South Asian Heart Center and our Chinese Health Initiative. We also have on-site translation services for family and patients. And our hospital is known far and wide for having a variety of yummy foods from all over the world. In addition, there are support classes offered throughout your pregnancy and your journey as parents, including childbirth preparation, new parenting classes, and breastfeeding classes. And speaking of breastfeeding, we have lactation consultants who visit every single mom after delivery right here in the hospital, as well as a lactation center on site that has a lot of breast pumps, breastfeeding supplies, and they have drop-in help. In addition, El Camino has private delivery rooms with comfortable fold-out beds for partners and family. Gosh, we have covered a lot of things today, from how to talk to your partner about becoming pregnant, getting more sleep, and all aspects of you and your partner's health, from family history, travel, genetic testing, and where to find more resources. I hope you found this helpful as you consider becoming pregnant. Our next webinar will cover how to get pregnant, common sexual issues, as well as preparing further for pregnancy. And you'll be receiving an email with an invitation to the next webinar, as well as a link for the resource guide. Again, thank you so much for joining, and now I'm going to answer a few questions. So right now you can go into the chat box and you can ask some questions. And I see that one has come in already. And the question is, how common is it for women to deliver a baby with Down syndrome at age 40? And the question is that right now we have NIPT, we have non-invasive prenatal testing for women. And that means that parents can find out as early as 10 weeks whether their pregnancy is affected by Down syndrome. And that means that parents can then ask questions and see a genetic counselor. The risk that a mom would have at age 40 of having a pregnancy affected by Down syndrome is 1 in 85, which is really less than 2%. So we have another question. The question is, I have PCOS. Is there any risk for pregnancy? I'm 30. I'm glad you asked that question. I take care of many, many women who have PCOS, which is also known as polycystic ovarian syndrome. When women are pregnant with PCOS, they have a slight increased risk of developing gestational diabetes. And so women with PCOS are advised to see their healthcare provider for a preconception visit, and that way they can find out whether or not they have an insulin resistance, what their hemoglobin A1C level is, and whether or not they need medication such as metformin to bring down the risk of diabetes or prediabetes. I'm hoping that the person who asked will see their healthcare provider and get those tests done. In addition, women who have PCOS are at slight increased risk of also having a thyroid disorder. And so that's something to also ask your healthcare provider about. I have another question, and that is, when in pregnancy do you usually start to feel pain? Well, a lot of women will start to feel a little bit of menstrual-like cramps in the first trimester as their uterus starts to expand. So they may experience this as pain or some cramping. Some women don't feel any pain at all in their early pregnancy. Other women will start to feel some breast pain because early in pregnancy their estrogen levels will increase dramatically, and that can cause a lot of swelling in the breasts. How do you know if, here's another good question, how do you know if you have an ectopic or tubal pregnancy? I'm so glad you asked that question. So the question is, how do you know if you have an ectopic or tubal pregnancy? Well, oftentimes women don't know if they have an ectopic or tubal pregnancy, but they know that something's not right. They may have some bleeding, or they may have some lower pelvic pain. With an ectopic or tubal pregnancy, this is a life-threatening emergency. So any woman in early pregnancy that has any bleeding or any severe pain where they cannot stand straight, where they have to bend over, needs to either go directly to an emergency room or see their healthcare provider as soon as possible. And when I say as soon as possible, I mean within hours, because an ectopic pregnancy, that's a pregnancy that instead of being in the uterus is in the fallopian tubes. If it outgrows and bursts the fallopian tube, a woman can bleed seriously, faint, and in very rare cases it can cause death. So ectopic and tubal pregnancies are something to be very careful about. I have another question. How can we conceive twins? Is that possible or not? And is it risky or not? This is a great question. If a couple wants to conceive twins, they should absolutely see their healthcare provider. There are oral medications that can increase the likelihood of women producing 2 eggs during a cycle. Women can see a reproductive specialist or an infertility specialist. They can discuss ways that hormonal treatments can be used to increase the likelihood of twins. Now, let's talk about the risks of twins. Although it may seem really like a good idea to have 2 babies at once and just kind of get it over with, pregnancies with twins are much, much higher risk than a pregnancy with just 1 baby. There are so many different risks that can occur for both mother and each of the children that many providers would sit down and counsel a couple about whether or not that was a good idea. Now, here at El Camino Hospital, we take care of a lot of high-risk pregnancies, including twin and triplet pregnancies. But again, these are considered high risk and would require added care. I have another really great question here. Do I have to get confirmed of pregnancy with an OB in first trimester before getting my first ultrasound? So the question is, do you need to have a positive pregnancy test by an obstetrics provider before having an ultrasound? And the answer is yes. In order to get your very first ultrasound, you do need to see a healthcare provider. You can't just go and have an ultrasound. And the reason for that is that there can be many, many issues that come up that are seen with that ultrasound, and it's important for people to have a provider that they've met and that they trust who can go over the results. So again, if you're thinking that you might be pregnant and you just want to have that first ultrasound, you'll need to make an appointment with an obstetrics provider. All right, so we have another really great question. What are the chances of delivering vaginally after a previous C-section? So we call a delivery after a C-section vaginal birth after cesarean, is also known as a VBAC. So what are the chances? Well, that really depends on why a woman had her C-section. So sometimes a woman has an emergency C-section if a baby maybe was in distress. And for those women, we don't know whether or not she can deliver vaginally, but that woman would certainly be a good candidate. Other women had to have a cesarean because the baby didn't fit through the vaginal canal or the pelvis. The bones of the pelvis were too small for that baby. But here at El Camino, I want to reassure you, we have many obstetrics providers, many OB providers who are very comfortable doing vaginal birth after cesarean or VBAC. In fact, many of them are quite successful at this, and women travel from all over the Bay Area to have VBACs here at El Camino. I have another great question here. When, in other words, what week in pregnancy should I come in to confirm my pregnancy? So the question is, you've had a positive pregnancy test, maybe you've just missed your period and you're about 5 weeks along. When should you make an appointment to confirm the pregnancy? Well, different providers have different protocols, but I'll tell you this. If you can wait until about 4 weeks after your missed period, so that you'd be about 8 weeks from your last menstrual period, that's really the very best time to come in for a confirmation of pregnancy, because at that time we'll be able to see with an ultrasound, and many of us do the ultrasound on the very first visit, we'll be able to see that the pregnancy is viable, and we'll be able to measure what's called a crown rump length and look for the fetal heartbeat. So about 8 weeks after the last menstrual period is what's recommended to come in for a pregnancy confirmation. I have another question here about thyroid disorders. The question is, I have a thyroid disorder and I don't know when I should see my endocrinologist. Well, if you have a thyroid disorder, it can change in pregnancy. So I'd like to advise anyone with a thyroid disorder to see their endocrinologist before they try to get pregnant, so they can make sure that their thyroid levels are completely normal. And during pregnancy, we advise women to get their thyroid checked at least every trimester. Here's another question. Can I continue regular daily exercise while trying to get pregnant, or will that affect my ability to get pregnant? This is a great question. It's really important for women to get plenty of exercise, not only when they're trying to get pregnant, but during pregnancy. And regular exercise will increase your stamina and blood flow to every part of your body. And so do continue to exercise while you're trying to get pregnant. I have another question here. Here it is. I'm going to just read it. I have had irregular periods since I started. Is there a way to check ovulation when periods can be 2 to 4 months apart? This is a great question. So for women with irregular periods, this is the time to go see an OB provider. What we often do is a blood test at between days 3 and 5 of a cycle, and again at day 21. When we do that, we can determine whether a woman is ovulating or not. Another thing that's important is For women who have irregular cycles, we often do an ultrasound to look at the ovaries and to look for a condition known as polycystic ovarian syndrome. Any woman who's having irregular periods should go in for a preconception visit because we often will do what's called a workup, and we do a number of different hormonal tests to see if the woman is ovulating regularly and what her chances are of getting pregnant on her own, as well as being able to give her advice about whether she needs medication to help her get pregnant. I have another question here, and this question has to do with how do I talk to my mother-in-law about not pressuring me to have a baby? This is such a great question, and it comes up in my office all the time. When we're talking about talking to your mother-in-law, it's often best to talk to your partner first and have your partner talk to their mother about the pressure. Oftentimes, a mother-in-law will listen more to their own child than they will to their child's spouse. And that brings up an important point. As you move toward becoming parents together, family influence can really affect how you feel about yourselves, how you feel about your baby, and how you feel about your partner. Mothers-in-laws, fathers-in-laws, aunts, uncles, everyone has something to say. But remember, you are a unique couple. This is your baby and your family, and so you'll want to make decisions together that are best for you. So, looks like, let's see if we have any more questions. Do we have any more questions before we stop? Well, I really want to thank all of you again for attending tonight's event. And don't forget, you'll be receiving a survey at the end of this webinar, and we would really appreciate your feedback to assist us in making these events relevant and valuable for the future. I want to thank you again for joining us, and we'll be sending you an email shortly with the name of our next webinar, which I think is Ready, Set, Go, Planning Your Pregnancy. So I'm Barb Dean, and I want to thank you again for joining us, and I hope you have a great night and good luck in your journey toward becoming parents. Take care.